I started the London Hip Unit about 20 years ago. At that time I was already an established hip surgeon in London. I was keen to enhance the patient experience by having a team of surgeons, specialist nurses, secretaries around who could give 24-hour service and be available to answer questions and to educate patients and deal with any problems that could arise. Over the years, this has turned out to be a really successful model. I frequently see patients 28 plus years following surgery, but with this degree of follow-up, the patients really become much more like friends than patients. I just really enjoy treating people and getting the feedback of making them better and healthier. More recently, I've increased the number of consultants here, and we now have 4. The people we've appointed are all handpicked by myself and all have NHS London Teaching Hospital consultant jobs.
Patients coming to the London Hip Unit, we tend to employ a multidisciplinary approach, which is the perfect way of collaborating between different surgical and clinical specialties. And this can be managed from all the way from joint preservation surgery right the way through to major hip reconstruction. The treatment pathways require expertise not just from surgeons, but also from practice nurses in outpatients or inpatient care with the ward nurses, physiotherapists, and practice management staff to help patients through their treatment journey. The multidisciplinary team meetings may be required for complex surgical challenges, which are formally discussed with case presentations where the patient's case history and radiological imaging is presented to the hip unit consultants so a treatment strategy can be planned for that patient.
Our highly skilled team can offer expert assessment and treatment options for all types of hip problems. This includes joint preserving surgery for young and active patients with conditions arising from prior childhood hip disorders, hip dysplasia, femoroacetabular impingement and sports injuries. All of our consultants have extensive experience in total hip replacement surgery and use a wide range of techniques and implants to provide the optimal solution for your hip. This could involve hip resurfacing, robotic surgery or alternative surgical approaches to get you out of pain and back to a better quality of life. Should you run into problems with a previous hip replacement, we are also able to provide a comprehensive assessment to rectify the issue, with redo or revision surgery where needed.
We pride ourselves in providing a highly personalised level of care. We ensure that we take time to thoroughly explore how the individual's hip disease affects them, and then look at all treatment options, be it surgery or non-operative treatment, to decide what is best for them. Our staff have a wealth of experience in guiding patients from all walks of life through this challenging time, from the preparation for and subsequent recovery from treatment, and are readily able to tailor this level of advice, guidance and reassurance to get you back on track.